Hello, my name is Muhammad ElSalhy.
Today I would like to introduce my paper about internet addiction. The paper title is Relationships between Internet Addiction and Clinico-Demographic and Behavioral Factors. First, I would like to talk in brief about internet addiction. Internet addiction is generally defined as a maladaptive preoccupation with internet use that interferes with everyday life. Such behavior frequently accompanies a set of clinical symptoms similar to substance use disorders. Internet addiction has different forms, for example, SNS, gaming, and porno addiction, and so on. There are multiple factors that are thought to be related to internet addiction, like social background and relationships, and psychological and cognitive functioning. Previous studies mentioned some demographic factors like age and sex, and clinical factors like anxiety, depression, and loneliness. Previous studies had some unclear points that we wanted to clarify in our study. More than 90% of the previous studies surveyed use of only either online games or SNS. Most of the previous studies targeted only one or two educational stages, for example, junior and senior high schools. Several studies were conducted online, while other studies were paper-based, so it was difficult to compare between different studies. A systematic understanding of how internet addiction varies among children and young adults is still lacking. And no single study investigated internet addiction comprehensively across students from a whole range of educational stages. Now I would like to talk about our study design and measures. Our study is a cross-sectional study based on anonymous self-report questionnaire. The questionnaire included demographic questions, questions related to internet usage, Japanese version of internet addiction test, and K6 scale. The demographic part included questions about age, sex, living place, and daily sleeping hours. The questions related to internet usage included age of first internet exposure, total time spent online during weekdays and holidays separately, and online activities. The main results of this study were the results of multiple regression analysis. The total scores of Japanese version of internet addiction test were the dependent variable. The independent variables included age, sex, number of family members, daily sleeping hours, age of first internet exposure, time spent online during weekdays and holidays, K6 total scores, SNS, games, study, and emails. The results showed that SNS, online games, psychological distress screened by K6 scale, and emailing were internet addiction predictive factors, while longer sleep duration, age of first internet exposure, and online study were protective factors.
Thank you for watching this video. Goodbye.